A serious health alert has been raised as infections caused by drug-resistant bacteria, often dubbed nightmare bacteria, have surged dramatically in recent years. According to a new report from scientists at the Centers for Disease Control and Prevention, CDC, cases of these stubborn infections increased by nearly 70% between 2019 and 2023. But here's where it gets controversial. The main culprit behind this alarming rise is bacteria carrying the NDM gene, which makes them incredibly difficult to treat. The CDC researchers detailed in an article published Monday in the Annals of Internal Medicine that only 2 antibiotics remain effective against these NDM-positive bacteria. Unfortunately, these drugs are not only costly, but must be administered intravenously, making treatment complicated and less accessible for many patients. This is a stark contrast to more common infections that can be treated with simple oral antibiotics. What's even more concerning is that bacteria with the NDM gene were once considered rare and mostly linked to patients who had received medical care abroad. However, while the total number of cases remains relatively low, the rate of infections in the U.S. has skyrocketed more than 5-fold in recent years. David Weiss, an infectious diseases expert at Emory University, described this trend as a grave danger and a cause for serious worry. The CDC scientists warn that many people may unknowingly carry these drug-resistant bacteria, which raises the risk of them spreading within communities. This silent transmission could transform infections that were once straightforward to treat, such as urinary tract infections, into persistent, chronic health problems. Dr. Maroya Walters, one of the report's authors, emphasized that this shift could soon be felt in everyday medical settings, like doctors' offices nationwide. To understand why this is happening, it's important to grasp the concept of antimicrobial resistance. This occurs when germs, including bacteria and fungi, evolve to withstand the drugs designed to eliminate them. A major driver of this resistance is the misuse of antibiotics, such as not completing prescribed courses or using antibiotics unnecessarily, which allows the germs to survive and become stronger. In recent years, the CDC has spotlighted these so-called nightmare bacteria because they resist a broad spectrum of antibiotics, including carbapenems. Carbapenems are a critical class of antibiotics, often reserved as a last line of defense against severe infections. The rise of bacteria that can resist even these powerful drugs is deeply troubling. The researchers analyzed data from 29 states that conduct the necessary testing and reporting for carbapenem-resistant bacteria. In 2023 alone, these states reported 4,341 cases of carbapenem-resistant infections, with 1,831 of those involving the NDM gene. However, the study did not provide information on how many of these infections resulted in death. Looking at the numbers, the rate of carbapenem-resistant infections climbed from just under 2 cases per 100,000 people in 2019 to over 3 per 100,000 in 2023, a 69% increase. Even more striking, the rate of NDM-related infections jumped from about 0.25 to roughly 1.35 per 100,000, marking a staggering 460% rise. One expert not involved in the study, Dr. Jason Burnham from Washington University, suggested that the COVID-19 pandemic likely played a role in this surge. He explained that the pandemic saw a massive increase in antibiotic use, which probably contributed to the growing problem of drug resistance. It's important to note that the CDC's data only paints a partial picture. Many states do not fully test or report these infections, and even in states that do, cases are often identified only among hospitalized patients who are sick enough to warrant specialized testing. Additionally, many hospitals lack the capability to detect certain genetic forms of resistance, meaning many cases go unnoticed. Crucially, the CDC's data excludes some of the most populous states, including California, Florida, New York, and Texas. This omission means the actual number of drug-resistant infections in the U.S. is almost certainly higher than reported. Dr. Burnham emphasized that the true scale of the problem is likely underestimated. This isn't the first time researchers have observed this troubling trend. A CDC report released in June highlighted a similar increase in NDM cases, specifically in New York City between 2019 and 2024. So, what does this mean for the future of infection treatment? Are we on the brink of a post-antibiotic era where common infections become untreatable? Or can new medical advances and stricter antibiotic stewardship turn the tide? This is the part most people miss. The battle against drug-resistant bacteria isn't just a medical issue. It's a societal challenge that requires awareness, responsible antibiotic use, and investment in new treatments. What do you think? Are we doing enough to combat this growing threat? Or is the rise of these nightmare bacteria a warning sign we're ignoring at our peril? Share your thoughts and join the conversation below.